Welcome to Nasdaq TradeTalks, where we meet with the top thought leaders and strategists in emerging technologies, digital assets, a regulatory landscape, and capital markets. I'm your host, Jill Malandrino, and joining me on the desk at the Nasdaq market site, we have Congresswoman Victoria Spartz and senior member of the U.S. House Judiciary Committee, Dr. Sandeep Chauhan. He's co-founder and CEO of Definition Health, and Aaron Oboh, co-founder and CEO of Liife. We're here to discuss the growing role of artificial intelligence in healthcare and its potential to enhance patient care, coupled with the critical need to protect sensitive data among evolving cybersecurity threats and regulatory changes. It is great to have everyone with us. Welcome to Trade Talks, and certainly thank you for joining us for Cybersecurity Awareness Month. Congresswoman, we'll start with you. Let's discuss innovation and security, the government's role. With increasing innovation in AI-driven healthcare, what role does the government play in balancing innovation and security in a highly regulated space like healthcare?
Well, I think healthcare space is overregulated. That's why we don't have as much innovation. But the government's role is to protect people's rights to life, liberty, and property. And data is a new type of property. So as a committee, as a Congress, we need to deliberate how we can make sure that we have a protections and privacy protection, but don't, harm innovation, because there are a lot of opportunities where innovation can change people's lives. And healthcare is one of the industries. Education and healthcare has the least innovation, because government controls. So I think we need to have a conversation how we can have proper legal framework, but also not to be a detriment to innovation. And unfortunately, Congress hasn't had that, so I hope after the elections we will.
Yeah, it certainly would be great, because it only extends accessibility and it democratizes healthcare, which of course is a key issue in the US right now. So Aaron, with your extensive experience in data management and system security, how do you see AI enhancing healthcare operations, and what are some of those key cyber challenges, because the bad actors are leveraging the same technologies as the good actors?
I know, that's a great question. I think there's two parts to it. The states, this is how I like what you just said about the government. So federal government has to provide governance. I don't think they're quick to jump into it. Now, what the states are trying to do is provide the guardrails. So they're creating the sandboxes, which is a place where we can play and try to encourage innovation. But you can't do that without the governance of the federal government. So we need those kind of regulations. It goes back to HIPAA from way back when. It started like that. We have to think about this, think outside the box. How can we safeguard and protect patient data? But the technology will allow us to do exactly that. If we think about it like we're thinking about it and trying to innovate on safeguarding the patient data. So one thing you mentioned was the concept of data wallets. I can go into details of it, but that's something we should kind of talk about and try to innovate on.
Yeah, we certainly should, because the underlying technology to that can certainly be transformational. And part of the challenge is too that the technology evolves much quicker than regulation can. And by the way, data begets data. So this conversation could look very different even 6 months, 1 to 2 years from now, because of once this is put together and structured and new products are developed off of it, the possibilities are endless. But Doctor, with AI transforming healthcare, trust is key. How do you balance pushing innovation while ensuring patients can trust the AI systems, because data is the biggest commodity that we have at this point?
Absolutely. It's a great question. I think transparency is one of the first things for both patients and doctors. There's lots of myths around AI and what it can and can't do, and transparency for doctors and understanding actually what are we saying to patients about what AI is doing, and for patients understanding actually what is happening to my data, what is its use, what is its security, and how is that security founded. And so, as a surgeon, we've developed some great tools to help predictive analytics around surgery, and it's based on clean data. But it's not us as surgeons, we've got clean tech behind us and real good experts, and by having clinical expertise and security expertise all meshed together, it engenders trust. People trust that actually their data is not going to go to bad actors. The data is going to be used for good going forward. And I think that's really, really important with all the regulations that Aaron, the Congresswoman, mentioned, regulating that closely. Yeah. That engenders trust.
Well, I mean, by the way, AI, it's not a new concept across many industries, but I think with Gen AI becoming part of the consumer vernacular, November 2022, when that really came out, there's that expectation, and we're talking about it more as a society when it comes to the ethical and responsible use of our data as we understand just how valuable it is. So Congresswoman, what upcoming legislative priorities do you think will impact cyber in healthcare and AI, what becomes more integrated into patient care?
Well, I think, if you think about it, healthcare is one of the biggest driver of our debt, and it's one of the biggest driver of a consumer debt. 1 of 7 Americans in insolvency for medical debt. We have hyperinflation of price, so we'll have to deal with healthcare. We go insolvent, we go bankrupt. 40% of our spending is related to healthcare. And we have hyperinflation of price, and the outcomes and values go down. So we'll have to have competition for value. And government need to get out of businesses and innovators to be able to compete. We need to have a legal framework so torts can regulate the markets. And if you do something wrong, that's what the best regulation. You can get sued, not create exemptions and immunity to some people close to the government, and then have some people judgment proof, but some people have overregulated. So I think we will have to have serious discussion. And I hope it's a very political year. We'll have a lot of drama, but hopefully after the election we'll have a serious conversation. And I actually had discussion with my Senate colleagues on both sides of the aisle in Judiciary Committee, and I said, let's just have a serious conversation. And we have a lot of members very interested. It's something new, and we cannot do it overnight, but we need to engage with stakeholders and be able to have deliberation and provide proper legal framework how we can protect consumer and privacy, but also allow innovation, because it can bring so much to the table and can improve people's life. And healthcare is one of the areas that affects us so directly.
Yeah. And it's a great point that you make, because of all technologies, this allows operations to become more efficient, regardless if you're in financial services, education, healthcare, and so forth. It's only a win because our healthcare system, for as advanced as it is, and some of the best healthcare in the world, is the structure is just baffling. Right,
yeah.
and this, I mean, if any industry can be transformed with artificial intelligence, this is certainly it, Aaron.
Yeah, so I think we should actually be able to leverage the technology, especially in AI, to help healthcare. So one of the things my co-founder and I are working on is trying to solve some of those complexity and try to reduce fraud, waste, and abuse you mentioned. So there's ways within the technology. One of the biggest, I guess, cornerstones is using blockchain. It was created for trust framework. Like, we're not really using it, outside of fintech and other industries, but in the healthcare, we should embrace that and use blockchain to just achieve that trust framework with the patient data and all the data that comes with, the doctor and that engagement with the provider. We can do that, and that's kind of the technology we're working on, because it is already there. We're not doing anything new, just leveraging what's there, and that's what the Congresswoman is alluding to, which we need to encourage that innovation around.
Yeah, and that's a great topic that you bring up, cybersecurity around blockchain technology. I mean, the whole point of it is accountability, transparency.
Yes.
I mean, supply chain management. Supply chains are in every industry, right? If it's all available in one spot that incorporates zero trust, I mean, isn't that the aim of this?
So that's a good point. So part of the challenge is what I've seen states are doing. They're standing up, they're called fintech blockchain sandboxes, but any industry can use it. And I want a voice for healthcare to have that same kind of environment to be able to innovate. And I'm great the states can support it, but it doesn't end there, because we also need the federal government to have some governance around what we're doing. Not slow us down, but allow us to innovate in the sandboxes. And because it becomes a thing about commerce between states, and once you leave the interstate, it becomes a federal issue. So they need to have a voice in it while we're leveraging the technology that's out there.
And the industry's asking for a framework. They're asking for the legislation. Doctor, when you think about it from the patient perspective, patient trust, this is going to be a big thing as well when you're pushing innovation and newer technologies, and not only from the clinical side of it, but also from the cybersecurity side of it. And if you think of it even more holistically, how do you earn patient trust at the end of the day while maintaining all these protocols on the cyber and clinical side?
I think through good evidence base, really. I mean, by using iterative AI technology during procedures such as surgery, we can show changes in outcome. And if you show that to clinicians, if you show that to patients, and actually show it's evidence-based, you can really change outcomes for not just patients, but providers and communities, and improve overall health in the process. So AI will be able to predict how well patients will do following procedures, for example. And actually, how do you intervene before a patient has a procedure to actually avoid them doing badly? So actually, on one side, we have a win where we can improve patient health. And on the other side, we've got a win where we can improve outcomes. I mean, that is the magic bullet that we've always wanted. And we're really almost there in terms of what we do, in terms of that predictive analytics. And for the first time, that data, and using that data really carefully in an iterative approach, as Aaron said. So don't try and go for a big bang. Do an iterative approach, so you're testing with patients, you're testing with security, you're testing with clinical teams. As you go along, you get a great result at the end. And the most important thing is make sure it's evidence-based. Keep it away from marketing, make sure it's evidence-based, get trust in, and actually you have credibility.
So no DTC advertising in this space, but no, it's interesting. We had a company come on that's in robotics, and one of the reasons they were testing it, not just for the clinical side, but to help surgeons make better decisions with that type of data. That's what they want, is to be able to quantify their rationale.
So I do robotic surgery all the time.
Right.
And actually, we helped pioneer computers in surgery 20 years ago. And actually, what data's enabled us to do is to show that making millimeter differences during surgery can make the difference between a good outcome and a less good outcome. And had I known that before, you would change what you did during the intervention. And actually, that's huge. It means that
saves money too in the healthcare system.
For the healthcare system, it's huge. Well, if you think about it, I heard an amazing statistic the other day that Medicaid spends $5 billion a year on knee replacement surgery. I thought that was huge. And then somebody told me that actually they spend $15 billion a year on aftercare. And if you can predict patients who are not going to do as well, you can support them properly, reduce costs, improve health, and improve outcomes overall. So I think the use of data responsibly is huge. And I think what's really important for patients and for clinicians like me is it's actually data that we can use in our day-to-day life. It's not a theoretical thing. It's something where if you come and see me as a patient, I've got some data on you, and it will tell me straight away, or help me straight away, as to how I treat you going forward.
Well, Congresswoman, that really is the question here when you think about ethics and responsible use of data and AI, how it's designed, how it's operated, how, when you think about legislation, what does that look like when you're trying to develop that framework for safeguarding patient rights and data protection? Because good data in is good data out.
Well, I think there are a lot of risks and challenges like in every industry, but we need to move to value-based healthcare. We need to get out of this volume-driven fee-for-service healthcare that, not getting the best outcomes. And I think AI will give us, and technology will allow us the transparency and ability to analyze the data. Doctors don't have time to sit down and analyze the data. AI has enormous opportunity there. But as I said, we need to make sure how we can put safeguards and protections to make sure that data cannot be manipulated, minimize the risk and protection of the data. And that is something not just in healthcare industry, it's every industry we're facing this. But I think we'll have to start looking what our bad actors are using, how we can be better at cybersecurity. It's happened. We have a lot of actors, not just even domestically. We have foreign actors that attack, and it's not, and look at the weaknesses. And this is something, I've been an auditing profession many years ago. We talk about cybersecurity, and it's changing and evolving. But I think we have to be a little bit more proactive too, and look at this risk, and look at what is the material risk and how to address it. And I think the government needs to do it. And as you mentioned, we need to make sure that we have a predictable legal framework and around the country. You cannot base such a big issue based on state legislation. It's interstate commerce issue. Congress needs to deal with that. It's not an easy issue. And our agencies needs to deal better. Department of Justice, FTC, we have to have better enforcement. We haven't been very good and have an enforcement mechanism and force other branch, executive branch, to actually investigate, deal with this issue, and punish bad actors. And we haven't been as successful, because if we start doing that, and then send that message that we're serious about that and protect data and deal with bad people, we will have enormous opportunities for good actors and innovators to change the trajectory of healthcare, which has to be changed.
Yeah. And again, to your point, the competing priorities between legislature and agencies and so forth, they just have to come together, because it is one of those issues where there is bipartisan support, to your point earlier.
Yeah, no, it is. And I think it shouldn't be a partisan issue. We can do a little politicking, and it's okay. But there are some issues, the national security issues, the issues of healthcare, protecting our country, and we have to find common ground, But we also, as Congress, has to take more responsibility to legislate. Chevron case from Supreme Court is kind of a good example to show we're not doing this job. It's actually my subcommittee is responsible responsible for that, so I have to take some blame.
No, but I think that's interesting though, right? Because there's a couple of arguments here. Agencies aren't elected, the legislature is. They should be representing their constituents and developing policy and law around this, because regulation by enforcement isn't necessarily the best framework either.
No, and I think people have no ability then to influence, right? We set up as a branch, we're Article 1 branch for a reason. With all of the drama, we have an ability to be replaced, and people have come, talk to us, they can scream at us, they can be happy with us, they can talk to legislative. An agency and administrative states that regulate and created laws, people have no ability to change. Businesses cannot have ability. Our administrative law, it became so material and becomes so really hard for businesses to deal with. At least you can, don't vote for me if you don't like me. What are you can do with these agencies?
Well, it almost became like a fourth branch, but unelected.
It is.
I think that was part of the basis with Chevron.
But Supreme Court sent a very strong message that Congress needs to start doing its job. So hopefully Congress will wake up after the election and will start governing, because it's about time. Because I truly believe the amount of innovation on the ground, including in healthcare, which we badly need. Our country will go bankrupt if we don't solve healthcare. I'm not joking. This is the biggest driver of national debt and of consumer debt. It's destroying our country right now. And we can do so many great things with healthcare. We have so many smart people there, but they're not able to deliver value because government becoming now controlling everything, and we create perverse incentives in the system.
Right. See, and that's what makes me nervous to that point, because when you start thinking about the ethical and responsible use, what are your motives for implementing, right?
So this is a good thing. I think we say that, and we all get scared because all the bad actors. That's all the news you hear. But in AI itself, we believe, my co-founder and I, Jamie, that we can start with the patient, right? You can try by really focusing on safeguarding the patient data. And Jill, you mentioned about generative AI. That's what it's there for. If we can do all those predictive analytics, analysis as we go through the process of getting to a provider, of getting the services, being able to look ahead and make create better outcomes, we can safeguard the data, and the technology is there. But what we're asking for is exactly what the Congresswoman is saying. Give us a sandbox and allow us to use, and don't make it restrictive for us to be able, because you'll learn a lot from working those sandboxes, and we can help influence the governance at the federal level, we can help influence the guardrails at the state level. But the tech is there. There's encryption, there's generative AI, which we can use, and we work at the speed of light. If we can let us do that, it's sort of, because all you can really do at the end of the day, cybersecurity, is mitigate the risk, and we have the ability to do it and build the trust in the patient that here we're doing all these things to safeguard the data. But so I realized cybersecurity is a team sport.
Oh yeah.
One person can't do it, three people can't do it. We all have to be part of the providers, the patients, local government, state governments, everyone has to be part of it, and we just need the guidance. The tech is there. What's what we're working on to do that.
So, Doctor, final words here. When you think about implementing these new technologies, are you concerned that it's perhaps going to market too fast and the risk management side is getting overlooked, or do you think from a clinical perspective that they're working in tandem with each other? Because to Aaron's point, it is a team sport when you think about ROI and risk management.
Yeah, no, absolutely. And I think that, if I'm honest, it's a mixed bag. There are certain technologies out there that are proven, that are working well, that should be rolled out further, that have clinical evidence, have ROI evidence, and have patient ethical evidence. So we're not producing health inequalities. We're not making patient health worse. But then there are other technologies that haven't got that proof, and they are getting rushed to market, and then the risk is that they'll fall down later on and taint the overall picture of AI in patient health and medicine. And it is a huge market, and obviously there's huge attraction, but there's a huge amount of benefit it can do for patients going forward, really. And ethically, we need to make sure that we don't make patients' health worse, either in a particular population group, by using data from a different population group, and making sure we're smart how we do it. Because there's a huge ability for us to actually make people in lower social determinants of health healthier by using data well, really.
And we will leave it on a positive note. Thank you for joining us on Trade Talks, and thanks for joining me from MarketSite. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.